guidance to primary care providers who might be seeing a patient or sharing a patient with you who's been newly prescribed an anti-epilepsy medication in terms of what they should be thinking about when they see that patient at a next visit, or screening for, asking in terms of side effects or changes that the parents or the patient may be able to identify since they started on this medication?
Okay, that is a very important part of the team and the management, the co-management of anyone with epilepsy who gets started on a medication, in that the primary care provider has the opportunity to look, well, certainly so do we, but to look at the whole picture and see the child in his or her environment, school, home, all those aspects. And I think the treatment of the seizures is only one part of treatment with an anti-epileptic medication or anti-seizure medication, in that they may do quite well at stopping the seizures and controlling them. That's great. That's what we want. There are a whole number of other considerations that we don't have as well studied and we don't tend to track as well, which would refer to the comorbidities of having epilepsy. Comorbidities of having epilepsy meaning the school performance, the mood, the quality of life, the other aspects, and the effect on the family of having a child with a chronic condition to begin with, so, and the community. So I think the primary care provider has every opportunity to ask about a lot more, and should be asking a lot more than just any seizures, how are you tolerating the medication. That's important as well, obviously that's the primary goal. But the other sides of it are a little trickier, a little less easy to have a body of data that says this will be so, but I think also very rich in terms of looking at how the adjustment goes forward. And I think the school performance is one big one, because the effects of anti-seizure medications on cognition, on thought and processing are still understudied, but it's clear we don't get away without any effects, and we can't just say that's not an issue for many children. For many it seems to be fine, but for many it isn't. And I think that looking at that and at least asking about it, asking about quality of life, about the strange things that people may do, because some people get so spooked out by epilepsy that they'll bring their children into bed with them, and they'll get monitors and alarms, and they'll get sleep deprived beyond belief, worrying over the seizure they might miss. So there's a lot to know about epilepsy that would help manage patients with epilepsy, and there's a lot of considerations of the rest of their life. Most every patient will have sooner or later a question about, managing the medicine, forgetting a dose, mixing it with other things, reproductive health, all those questions that do come up and are important, as well as mood. And I think it's not completely on the PCP to have to do all those things, but they're in a good position to keep, as part of the team, that conversation going. Yeah. And just one more thing I would say to the primary care providers: don't be afraid of all these numbers of medications that are used to treat epilepsy. Get to know them. They're really not as daunting as they seem, and getting the experience and the comfort in managing them, getting to know what their particular side effect profile might be, really will help the whole situation, and can be something the primary care provider expects of the neurologist, if the child's going to a neurologist, in terms of really having an educational part to it whenever a new medication is started. So for the specialists, it really is important for us to include some discussion about the medication for the primary care provider to feel like they understand it and know it a little better. But for the primary care provider, don't be afraid of the medications. They really are wonderful, and you can get to know them pretty easily.